Okay, I think let's start. So very good morning to each and every one of you. We appreciate your presence here with us this morning. So for the next hour or so, we are having a special COVID vaccine Q&A session. There are two reasons why we are having this talk. The first is to update us on the current situation. It's been around 3 months since we had our last vaccine talk, and we do think that it's good to give an update at this time. Our second purpose for this is also to engage those who have questions or those who require clarification regarding COVID vaccines. Our Kyrie announced that the AZ vaccine will be available first come, first serve. That's something that's new also. So I think many of us have questions about that. Today, what we'll be doing is that we'll be having our elder, Dr. Fong, who will be giving a short update. And following that, we will spend the majority of the time in the Q&A, which will be moderated by Pastor Melissa. So do take note that there are two ways in which you may ask questions. During the Q&A session, the first way you may choose to do so is to first unmute yourself and you can ask verbally. However, if you are shy or you think too many people are speaking, you may write the questions in the chat, and then Pastor Melissa will then read your questions to Dr. Fong on your behalf. So yeah, there are two ways to ask questions. The first is to unmute, and the second is to just write your questions on the chat. So let's start with the word of prayer. Father, as we gather here together this morning to talk about vaccines, we want to pray for clarity, for wisdom, for a spirit of love. So we want to pray that your presence be with us this morning. In Jesus' name, amen.
Amen.
Okay, so on to you, Elder Fong.
Thank you, Pastor Yu Yong. I'm just going to screen share now. Okay, so COVID vaccines Q&A. Okay, first of all, I want to declare that I have been vaccinated and I completed my vaccination just under a week ago after receiving the second shot. As you can see, I haven't grown horns yet, haven't turned green, so I feel fine. I will explain later if we have time about my experience of the vaccine itself. So I just want to address some of the questions that is already floating in people's mind. So if your questions are already answered with this very brief 20 minutes introduction talk, if your questions has not been answered, then later you can raise them, and then I'll try my best to answer them all. Now, first of all, the first question we have to ask is, does COVID vaccination works? In the initial studies, the clinical studies, it seems to work, but does it work in real life, which is the most important question. Now, if you look at the data that we already have available, and these are real data, yeah. For example, if you look at Israel, after they have been vaccinated, you can see that at its worst, Israel has about 10,000 cases a day, based on a population of about 8 to 9 million. So it's equivalent of Malaysia having about 30,000 cases per day, which is like a really scary number. But you can see that vaccination have driven down the numbers really down to really low numbers. And Israel is one of the countries that have vaccinated most of the population. And in fact, a few days ago, they say that they can go outside without wearing masks. So you can actually see that there's an example of the pandemic can be ended, okay? And one of the ways, in fact, the most effective way, I think, will be through vaccination. Now, if you look at the case in United Kingdom, which is the worst hit country in a way per capita of people involved. At the worst point, 60 million people, 60,000 people were infected. That's equivalent to about 30,000 cases in Malaysia, because the population of UK is twice Malaysia. And again, since vaccination has commenced, the number has dropped drastically, such that last weekend in the cup final between Manchester and Tottenham, it was played in front of a crowd of supporters in the stadium. So life can potentially come back to normal again. Now, if you look at the case in France, if you look at the numbers, France have got far higher vaccine hesitancy. In other words, the population of people who volunteer for vaccine is lower, much lower than in UK. And you can see that although there are some effects, but it's not so effective. So France at the moment is still struggling with approximately 25 to 30,000 cases a day, which compared to Malaysia, if you translate to Malaysian numbers, it will be about 15,000, because again, French population about twice that of Malaysia. If you look at India, which is now, I think, in everybody's mind, have now reached, as of yesterday, 400,000 cases a day. And you can see that the devastation that is being caused there. Now, before this latest upswing in numbers, we are thinking that, oh, maybe Asia is more protected. Maybe we have got TB vaccination in the past, we're more protected. Or maybe because India is using some medicine, is more protected. Maybe they're drinking turmeric water or eating curry and so on. But we know that that's not the case. That's not the case at all, because now India is facing it's really a very desperate situation whereby there are 400,000 cases a day, and people are dying in huge numbers. Now, if you look at India, right, it's very interesting. Now, in February, whereby things are quite good, the hesitancy for vaccine is high. Okay, in other words, only 38% of people say that I will take the vaccine when I take a survey by the Times of India. But last week, when they repeated the survey again, the hesitancy has dropped drastically. Now 77% or more would say that they want to take the vaccine. And here shows something very interesting. It's that when we don't feel threatened, when we think that we are relatively safe, we don't want to take the vaccine because we feel safe. But once we don't feel safe anymore, then we want the vaccine. But the problem is that India is facing right now is that when people want to take the vaccine, they cannot vaccinate them fast enough because of vaccine limitation, as well as the access to vaccine, as well as the health care workers are all totally taken up by dealing with the COVID disease itself. And while you want the vaccine, while they want the vaccine, they can't get hold of it. So there are even reports of people in India offering $1,000 to $2,000 for a single shot of vaccine so that they can be protected. But they can't have it now because of limitations. What is the situation in Malaysia? Now, if you look at India, okay, which I think is in everybody's mind, right? India's population is 40 times that of Malaysia, okay? There are 400,000 cases in India as of yesterday. This time was prepared 2 days before that, it was 3,500 cases in India. Now, it is equivalent of about 9,000 to 10,000 cases in Malaysia. Now, if you think about that, right, at our peak, we hit almost 6,000 cases. And if you look at the numbers, I think if we don't do anything different, we will probably hit 6,000 or even more. You can see that actually Malaysia is not far away from that 9,000 equivalent cases that we are seeing in India. And you can see the devastation there. Now, why does just a sudden increase of not that much more can cause so much havoc? It's because the health service is overwhelmed. The moment the health service is overwhelmed, that's where your cases will just exponentially increase. And when you can no longer contain people who are symptomatic, that means they cannot go to a health center like hospital. They have to quarantine at home. That's where the whole thing will just blow up, like what we see in India, like what we saw in Italy, in UK, in the United States, and so on. Now, it doesn't take that long for Malaysia to get there based on current numbers. Okay, so just bear this in mind, because when the time comes, when things are desperate, it's far harder to then control and far harder than to decide to take precautionary measures. Now, what is the Malaysian situation now? This is a Facebook post by our DG of Health, Dr. Hisham, just yesterday. Okay, there are 277 critical care ICU beds in Klang Valley, of which about 150 are for COVID-19. As of 1st of May, which is yesterday, it is 90% filled up. The 10% will be filled up, I reckon, in the next 1 to 2 or 3 days. So we are coming to that state already whereby we are reaching that limit, whereby we'll be tipped over and we still don't get things under control. We may be seeing, some kind of Indian-like situation. Okay. So what are the ways to deal with this? One of the ways that we can deal with it, in addition to the SOPs of mask wearing and social distancing, which work very well, but it's extremely hard to maintain because human being human, we are fatigued by it. So therefore, when the MCO is relaxed, we see people just flood into the shopping centers, people eat outside. Even today, people go outside and they do their mask wearing and so on, but they just cannot maintain it for long enough time. And that's a challenge. So vaccination is one way forward, okay? So COVID vaccines are available in Malaysia now, but how good are they? Okay, so I just want to go through quickly. So we have the Pfizer vaccine, which this is the one I have, mRNA vaccine, okay? Then we have got the Estrogenic vaccine, and then we have got the Sinovac vaccine. We also have ordered CanSino Bio from China as well as Sputnik, but they are not quite available yet, and they're also not approved at the moment. Now, if you look at the effectiveness of the vaccine, right, is high, okay? Basically, you're getting about 90% for a lot of the vaccines. For the viral vector vaccines, like AstraZeneca and Can, it varies a bit from 60 to 90%. So there's a variation. Now, it's very important to note that it's not 100% effective. Vaccines are not 100% effective. So I see a lot of WhatsApp posts and say, oh, you get the vaccine and therefore, but you still get the coronavirus. Yeah, reports of people. Then what's the point of taking vaccine? That's a wrong answer to that question because they don't have to be 100% effective to work. They just need to work. Even 90% is good. So imagine if, let's say, the population of Malaysia who are positive now, 3,000 over cases. If let's say 90% of them are actually, or 100% of them are actually vaccinated. In other words, maybe only 10% of them will get it. So our numbers instead of 3,000 over will be only 300 plus, which is a huge difference because then the strain of on the health service will be much reduced. So vaccines don't have to have 100% effectiveness for it to work. So I think we have to drop this idea that we demand vaccine to be 100% to work before we even take it, because you don't have to. Even if it's 90% or 80% or even 50%. 50% work on 3,000 people means half the amount of people, only half the amount of people get it. And that is still wonderful. Now, but the more important thing is that vaccine is almost 100% effective against severe disease. In other words, if it works for when you're vaccinated, you don't get the severe disease that put you in ICU or kill you. That is effective. That means you make COVID-19 just like an ordinary flu, and that's good. That's good enough for me. So you don't have to work 100%, but if it saves you or to keep you well, I think that is also a sign of a good vaccine. In fact, most vaccine works that way. Now, how about the efficacy, the effectiveness or efficacy against the variants? Today, there are actually about 50 variants already of COVID-19 mutation, out of which these three are the common ones. So if you look at the variant from United Kingdom, okay, thankfully, the vaccines that we have in the Pfizer, the Astrazeneca, and Sinovac, which is the one we have the same efficacy. So it's good. Now, for the South African variant, that is a problem because there is some resistance already in some of this South African variant. Although it still works for Pfizer, okay, the antibody levels is reduced, but it still works. So therefore, it's still being used in South Africa. AstraZeneca have got a reduced efficacy, so it's not so effective against the South African variant. Sinovac also reduced antibody levels. So you can see that sometimes mutation can cause problem in vaccination. So vaccination is actually very important to do quickly because we want to prevent this mutation developing, the chance of the virus mutating into a variant that is resistant to vaccine. So speed is also of an essence. So this sitting and waiting also carry a cost, okay? A cost and a risk. Okay, now I think everybody's mind at this moment, we're thinking about vaccine. We're thinking about the AstraZeneca vaccine, right? Because we hear so many reports on the blood clot issues. Now, prior to this, before this came out, of course, we are worried about the Pfizer vaccine and about the mRNA, causing cancer and all the rest of it, which are all impossible. But that story is now forgotten already, all right? Because people are no longer worried about that. Now, everybody's clamoring for Pfizer vaccine now. But how about the AstraZeneca vaccine, which is now available? Now, if you look at United Kingdom, which has probably vaccinated the largest proportion of its population and with good documentation of the result, is UK. Now, UK started vaccination end of, towards the end of November. And you can see the numbers dropped drastically to now less than Malaysia. So UK has about 1,000 cases of COVID disease reported daily, and Malaysia many times more, and their population is twice Malaysian. So you can see that in UK it has worked. Okay, if you look at the vaccination level of UK, it's really impressive. For people above 50 years old, they have vaccinated 90+% of their population. And therefore, the numbers of people with severe disease and people who die from COVID dropped tremendously in the UK. 90% of people above 50 have received their first vaccine dose in the UK. And that makes all the difference. Okay, and this is real life data. This is data that from UK is no longer a conjecture or we don't know, it's actually firm data. And of these people who have this vaccine, 21 million of them have the AstraZeneca vaccine. Okay, in some ways they are fortunate because they have vaccinated them prior to all this news report, because the hesitancy is there at the time is low, and it works, and it's conclusively shown that it works. And the amount of lives saved and the amount of days in ICU saved is a lot. Okay, so what about this blood clot issue? So let's deal with it now. This becomes very pertinent for all of us because of what Kyrie announced a few days ago, that because of this resistance to the fear of this AstraZeneca vaccine, the government decided not to put it in the normal vaccination program. Why? Because if they put it in a normal vaccination program whereby you cannot choose, people then get frightened of taking this vaccine, will also do not want to go vaccination, even if they may get Pfizer or something else, because they don't want to get this exact vaccine. So therefore, by removing this from the compulsory, you can't choose vaccine to a first come, first serve vaccine, then people who are not hesitant, who are not afraid, who feel that the risk is very low, would then go for it. So this is a way to save the vaccine so that it's being used. And then it also allow a way for people who are low in priority, but actually need to be vaccinated because they are in industry where they meet with a lot of people, but they are not frontliners, to have access to the vaccine. Okay, so this is what the government has decided. And because of this, a lot of people now are thinking of whether they should take the AstraZeneca vaccine. Now, we have only about 250,000 doses currently, that is in Malaysia, as far as I know. But Malaysia has ordered 12 million AstraZeneca vaccine that can vaccinate 6 million people. So if the uptake for this voluntary basis, first come, first serve basis is high, then I think this vaccine will be made available to a lot more people. And then our vaccination rate can increase much faster. So let's talk about the blood clot. Okay, now this blood clot is a very specific one. It's called TTS, or thrombosis with thrombocytopenia syndrome. Okay, what does it mean? Thrombosis means a blood clot. Okay, thrombocytopenia means that the platelets. Okay, one of the things that clot your blood is called platelets. The platelet is used up for this blood clot, and when the platelets are used up, you can no longer clot. Therefore, you then get hemorrhage. So it's a very dangerous combination. First of all, you clot, so you block your blood vessels. And secondly, when you use up all your platelet, you also go into bleeding, which can cause a problem. Okay? So people are frightened of this particular condition. Okay, and that's the case. Now, but how common it is? How common it is? If you look at the UK data, for young people, it's commoner. It's 1 in 80,000. Okay, but when you look at the older group people, it's 1 in 500,000 injections. Okay, but if you take it on the average, it's 1 in 200,000, or in other words, 5 per million. Okay, let's say the whole of Malaysia is only offered one vaccine, which is the exact vaccine. Everybody have no choice. There's only one vaccine available, excluding children. We have to vaccinate 25 million people. This is everybody in Malaysia. Okay. Now, if you have 5 per million, in 25 million, you will have 125 cases of TTS. If you vaccinate the whole population in Malaysia, it probably would take about a year to do it. You get 125 cases of TTS. Okay. So in other words, you will have 125 cases of TTS in the whole year in Malaysia, vaccinate the whole population, out of which maybe 40 will die. Now, if you then compare this to something that we can actually compare with, for example, how many people die on the road due to road traffic accident in Malaysia? It's between 7,000 to 9,000 deaths in Malaysia per year. In other words, road traffic accident killed 200 times more people than the exact vaccine if the whole population is vaccinated by AZ vaccine. Can you see when you compare the risk? But yeah, okay. How about food poisoning? Okay, road traffic accident. Some people say, oh, I don't go on the road, or I drive a very big car that's very safe. You know, I'm not a motorbike driver, so I'm not a mud rampant, so my risk is low. Fair enough. How about food poisoning? 1,500 to 2,500 deaths due to food poisoning alone per year in Malaysia. In other words, food poisoning is 50 times more likely to kill you than AZ vaccine. In other words, maybe we have to give up our char kway teow in that dodgy looking hawker center, because the risk of food poisoning is actually 50 times that of AZ vaccine over a period of one year. But when we go out and eat char kway teow, right, this morning or yesterday I went to eat char kway teow in ONS. Today I also I went outside to order takeaway food from Taman Mega, okay, and I happily ate it. I didn't even think about this risk of food poisoning that may kill me. We don't process that, okay. So I just want you to think very carefully, right? Because if you are very hesitant, you're very worried about this vaccination risk, you should, at the same time, be equally or 50 times more worried about the food that you order from hawker center, because it is 50 times more likely to kill you over a year period. Okay, just think about that, right? Just think about that. So when we weigh risk, we don't say that vaccine have to be 100% safe, 100% effective, then only I'll take it, because that doesn't make sense. The same way, you don't say that the car have to be 100% safe before I'll sit in it, or the char kway teow in ONS or in Taman Mega has to be 100% safe before I eat it, or the water has to be 100% clean before I drink it. It's about weighing the risk. How high is the risk versus the reward? In this case, the risk of vaccine is far, far lower compared to the reward that we can derive from it. Secondly, when you weigh the risk of COVID vaccine, you don't compare it with no risk. You see, whenever we talk about risk, we have to weigh it. Risks are to be weighed, is to be compared. So the risk of COVID vaccine has to be compared with the risk of vaccine or the risk of COVID disease. You cannot compare it with no risk, because in reality, it's not no risk, because the risk of COVID disease is actually high. So how do you compare? So let's give a scenario. So this is a very complicated slide. This is taken from the UK data. So let's say you have low exposure risk, which is where Malaysia is now. Malaysia is going into a medium exposure risk category now. But prior to that, maybe a month ago, we are at sort of low risk exposure. Then you can see that this is the risk from the vaccine, okay? For the young people, 1 in 100,000, so 10 in a million. For the older age group, is 1 in 500,000. When you compare with the risk of ICU admission, whereby 1/3 of people will die in this particular issue, you can see that the comparison is that the risk of vaccine is far lower than the risk of having severe COVID. And this is in a low exposure risk environment, okay? Now, as the risk of COVID increases, like what has happened in India and what is happening in Malaysia, then your risk assessment completely changed. Because now, although the risk of vaccine remains about the same, the risk of having problem from vaccine or from COVID becomes higher and higher and higher. And therefore, this risk becomes less important compared to this risk. And that is what's happening in India, whereby the risk, the hesitancy for COVID vaccine reduces, right? From only 38% wants to take the vaccine now to 77% or 80% want to take the vaccine. Okay? So you have to bear that in mind. And because Malaysia is heading into this direction, it's something that we really need to consider, because your risk assessment is no longer the same. Okay? What is long COVID? Okay, a lot of people hear this thing about long COVID. Some people say that, oh, I survived COVID, young people, I survived COVID. It's okay, my chance of going past COVID is quite high, so I'm not worried. But as a medical practitioner, we have something else to worry about, and so has the patient of COVID, people who are COVID positive, is this thing called long vaccine, long COVID. What's long COVID? Long COVID is the effect of COVID even after the active infection is over and you survive it. Okay, so what are they? Okay, I just explain to you. So there are a whole long list. You have psychological effect, depression, anxiety. You've got earache, sore throat, breathlessness, cough, skin rash, fever, fatigue, loss of memory, headache, sleep disturbances, dizziness, chest tightness, palpitation, abdominal discomfort, and joint pains, and so on. So fairly miserable long list of things. But how common it is? So if we look at the UK data, okay, the fatigue part is the commonest, and you can see the whole long list. But if you then look at how many people are affected, there are over 1 million people in the UK who report long COVID symptoms. Okay, out of which, if you note here, 200,000 of them actually experience it a lot, to the extent that it incapacitates them during the day-to-day activity, day-to-day functioning. See, so COVID, even if you survive it, right, it's not that we necessarily go back to normal because of this long COVID problem. Okay, so that's something to bear in mind. Okay, that when we look at COVID effect, we should look, in addition to the death that it caused, we also must look at the long-term effect of the COVID disease itself. Okay, I'm going to stop now, very soon after this next two slides, and then I will give you an opportunity to ask questions. So my take-home message is this, in a very short presentation, is that COVID is a serious health disease. Not only can it kill you, people, especially who are vulnerable, it also has got long-term side effects. Now, we know for certainty now, with great certainty, that COVID vaccine work. It doesn't have to work 100% of the time, but it's effective enough to help us through this pandemic. The risk of COVID vaccine, which is what most people are worried about, is actually very, very, very small. And the risk of vaccine, the COVID disease itself is much, much higher. Therefore, the risk of dying on the road due to a road traffic accident or from food poisoning, we have to eat every day, is much higher than the risk of the COVID vaccine affecting. And vaccination protects us all and protects others. Now, this is a photo montage of people in PGFC. Some only, not all, I only managed to get some of them, who have already been vaccinated. Okay, you have Joash here, you have Evelyn here, you have Ruth here, you have Timothy Cheng here, you have Yuk Fan here, who is the mother of one of the impact youth. You have Joel here, Joel here, we have Tim Sim, you have Gek Cheng here, you have Hui Min here, you even have Hera here, and you have myself here. Okay, all of us have already had the vaccine. Yeah. And we all make decision to protect ourselves, to protect our loved ones, and to protect you. Okay, so I hope everybody will make a sensible decision too. Okay, so let's go back to the question and answer. I'll stop screen share now. Okay, and I will open this time to question.
Okay, just a moment. Thank you, Elder Yifeng, for a wonderful presentation. Because there are over 200 people on the platform today,
Okay.
we will welcome your questions through the chat. Now, if you don't know how to use the chat and you really want to ask a verbal question, could I ask that you somehow indicate through your reaction button that you want to, maybe it's a thumbs up or something like this, to show that you want to actually ask a verbal question. And Pastor Alexa or Pastor Yong will just note your name so that when the time comes, I will call upon you to unmute to ask your question verbally. Okay, hopefully that's clear. Now, I'm going to start a very simple question, Elder Yifeng. This is asked by Karen Choong and Chun Lin. Should a thalassemia patient, whether minor or major, take the vaccine? Take any vaccine?
Yeah, thalassemia, whether minor or major, is not contraindication for vaccination. That's it.
Yeah,
it's not okay. Not that means you can take it. Contraindication means that if you have it, you can't take it. No, you can take it. Yeah.
Okay, thank you. The next one actually is regarding autoimmune diseases. Should an person diagnosed with an autoimmune disease be vaccinated? That's question one. Question two is on the MySejahtera app. Is an autoimmune disease considered immune deficiency?
Okay, autoimmune disease is a condition, there is a whole bag of conditions. So it's actually very varied, and the treatment for the autoimmune disease condition is also very varied. So I think because it's very complex, is some autoimmune disease, if you're on active treatment, vaccine may not be effective for you while you're on active treatment. Therefore, your treatment may have to be delayed. Okay. Now, because it's so complex, and I do not know what autoimmune disease you have, and I do not know what stage of disease you have, it's best that you consult with the doctor that takes care of you and ask his or her opinion. That would be what I would say. But generally, autoimmune condition is not, doesn't mean that you can't take the vaccine. Okay, in fact, most people can, but under certain conditions, you cannot, or you cannot yet. And because I do not know what is your circumstances, it's best that you then ask your doctor. Okay, but having the condition itself does not mean that you cannot take the vaccine. Okay, the second question is that is autoimmune equivalent to immune deficiency? Now, if you have autoimmune disease that's very active and you're taking immune suppression treatment, then by definition, you're also immune deficient. Again, my advice to you is the same. Consult your doctor. You just need to call him or just make an appointment to just see him. Can I take the vaccine? And the doctor will just tell you based on your condition and your treatment whether you're okay for it.
Thank you very much. So I think in summary, if you have an autoimmune disease that you know of, it would be best to consult your treating doctor, your treating physician, on whether you should take the vaccine now. Next question has to do a bit with how does the Astral vaccine work with people who are on blood thinners? Are they at higher risk of blood clots, or and should they actually choose to take the easy vaccine?
Okay. The blood clot situation in the AstraZeneca vaccine is actually a very specific type of blood clot. It's not the normal blood clot. It's actually tied into a condition called heparin-induced thrombocytopenia. So it's a very, very rare, very, very unusual type of blood clot. It's not your normal, I got a heart clot in my heart, or in my brain. I have a stroke before. I had a heart. I'm on aspirin as a blood thinners. Now, those kind of anti-blood clot medication I take is not. It doesn't stop you from taking the AstraZeneca vaccine. Okay, so it's a very specific thing. So what you do, because I've been through the vaccine process, is that it's okay when you apply or when you register, right? You have to answer this question. You just answer as truthfully as you can. They don't stop you from going for the vaccine. Okay. Now they will consent you during the time when you go to the vaccine. They will ask you a series of questions. And they are trained professionals. So if they think that they are not sure whether you are a good candidate, a doctor at that place in the vaccine center will then talk to you and figure out. If they feel that you are not suitable, they will then say, okay, we need more information here. Therefore, we will delay your vaccination until we understand this better. But if you fall under the able to be vaccinated, they will just proceed with it. So it's a very controlled environment process, okay, whereby when you go there, they will take the necessary step to identify those who are unable to or not safe to be vaccinated, okay? So for me, it's a decision that you don't have to make yourself, okay? You just get yourself registered, you want to get vaccinated. You let the professionals, your doctor, and the person in the vaccination center help you with that decision making, okay? For you, you want vaccinated, you're not sure, you register first. I think that would be the main thing.
Okay. To sum that up, what you're saying is that when we fill up the forms to apply for register as a vaccine candidate, these questions will already point the professionals to know how to evaluate our risk, and from that risk factor, they will advise us what to do.
Yeah.
Okay.
So I know of colleagues who have got some condition that they want to vaccinate, they go there, but then they are subsequently found out to have, let's say, a severe reaction, previously that we feel that is not good. Then the vaccination center said that, okay, look, this particular vaccine has got this particular reaction, therefore you should wait for the next one along the line. So they actually take the due process. So you don't worry about it. You just get yourself registered. If you have a normal doctor who takes care of your condition, have a word with him or her, find out that you're okay. If they say it's okay, then go ahead and go through the process.
Okay, I see a question from Ang again regarding the autoimmune person. I think Elder Yifeng has already answered that if you have an autoimmune condition, it's not whether the vaccine is live or whether the vaccine is mRNA, you would need to consult with your treating physician to know whether it's suitable for you to take the vaccine. Right. So Tang, if you are still not satisfied with this reply or this response, could you text Master Yu Yong directly so that we could also just take this offline with you?
Yeah, okay, because there's a lot of question on allergy reaction, right? So I just want to maybe just cover that so that we answer as many people's questions as possible. Now, if you just have a normal skin rash, your eyes swell up, I'm allergic to non-steroidal anti-inflammatories. For people who know NSAID, NSAID, like aspirin and so on, I'm allergic to that. I'm also allergic to penicillin. Okay, me. Okay, I'm vaccinated already. Yeah. So the allergic reaction depends on what kind. If it's just a skin rash, you could just have got little hives on your body, rash, swollen eyes. It's not a contraindication. Contraindication means that it's not something that prevents you from getting vaccination. Now, if you have a very severe reaction, let's say you cannot breathe after you're vaccinated, after you have taken prawns or anything like that, you have to just inform the person vaccinating. It's still not something that will prevent you from vaccination, actually, because I know people who have prawn allergy who have been vaccinated. But the person who is doing the vaccination, the doctors in charge there, they will know exactly when to say that you can't have a vaccination. Okay, they know what to do. All right. So I would say that you just registered and you answer the questions based on what is asked, and you go. And if you're not a candidate for vaccination because of allergy or whatever it is, they will not vaccinate you. They're all trained to screen out the people who are at high risk of reaction to the vaccine. Okay, you don't have to make that decision. You just have to decide you want vaccination or not vaccination. You just give your answers as honestly as possible so that the doctor who is at the vaccination center can make a decision, a safe decision for you. Okay, if you're still not sure about that because you meet this doctor for the first time, you don't trust him, talk to the doctor that take care of you all the time. And they will tell you what it is. Okay. I do not want to give a blanket answer. You understand what I mean? Because I do not know you personally. I do not know your allergy. I do not know how you respond. So it's very hard for me to do that. I'm just saying that having an allergy is not a reason for not vaccinating.
Thank you, Elder. The next questions have to do with the AstraZeneca vaccine. The first one is there an age category that's more at risk of the TTS than others?
Yeah, I think in the talk I already mentioned that from the study, it seems to show that the younger people, female, seems to have a higher risk of this particular blood clot. Okay, whereas the older ones, the risk drops down a big deal. So you're talking about for young people, younger group female is about 1 in 80,000. 1 in 80,000 jabs, which is actually a very, very low risk jab. Therefore, this side effect wasn't noted in the trial because in the trial, there's only 20,000 people who have the jab, which is really a huge number. So we didn't pick it up. So this is something we picked up after the vaccination has been in progress. So like I mentioned earlier on, if you translate that risk to the Malaysian population, if every one of us get the AstraZeneca jab, you're talking about 125, maximum 200 cases for the whole of Malaysia, out of which maybe 40 people will die. Yeah. Okay. The age is that if you're above 60, is 1 in 500,000, 2 in a million. If you are above, from 50 to 59, is 1 in 250,000, or 4 in a million. And sometimes it's very hard to juggle this kind of data. Yeah. Anyway, dying from food poisoning is 50 times more likely within this year than having the jab.
Thank you for that. Okay, I think that's a very good question that came up after this whole thing is that if, let's say, I'm one of the 4 in 1 million that had the clot, will I die?
About statistically at the moment, I mean, previously based on the data was 30% may die. But that's partly because at that time, they don't understand how to treat it. When you have a blood clot, you go to the hospital. So what we tend to do, the doctors to try to unclot you by giving you heparin, which is the wrong thing to do because the heparin will make things worse. Heparin is an anti-clot agent. Now that we understand this condition, the doctors understand this condition, and we are looking out for it, I think the survival from this condition will be much higher moving forward. Okay? Because now the doctors are all, our antenna are all up already, right? All right, okay, we are looking for this condition. And we know what to do. Because last time we found the condition, we treated wrongly. Now we know we found the condition, we will treat it rightly. So then I would anticipate that the death rate from the TTS will reduce with time.
Okay. Next one's a little bit of a complex question in the sense that if I've received this AstraZeneca vaccination, what are symptoms that I can look out for to indicate whether I'm having a clot? And 2, what if the symptoms, because the first question that Meng Yu raised was, if somebody already exhibits 4 out of 7 of these symptoms before taking the jab, should they even take the jab?
Yeah, the problem with symptoms for this particular blood clot is actually also quite generic. So the part of the problem is that so a very persistent headache is one of the common ones. Okay, it also depends on where the clot is. If the clot is in the lung, we may get breathlessness. But then immediately after the jab, some people get breathless as well from the immune response to the vaccine. But basically, any breathlessness, headache, discomfort that lasts more than 48 hours, I would say that you have to then consult a doctor. Or if in doubt, if you're worried, even after 24 hours, consult a doctor. It's fine. We will see you. The doctors will see you. It's okay. If you get it. I know a lot of people are very worried about it. I just want to give that perspective. You can very easily Google all these symptoms for TTS, and you can look at it. But the most important point I want to make is that we need to put risk in perspective. That is one of the major points. I don't particularly want to label too much on all the final points on what are the risks. It's a bit like saying, what are the risks of taking a flight? So if I want the whole list of the risks of taking a flight, then I go to a flight. So the airlines give you a long list, right? Okay, the wheels may fall off, the engine may stall, the doors may not open, the oxygen level may fail, the pilot may faint, There's no end to this kind of thing. Okay, there's no end to it. You can have a whole long list of all the risks that we want to look at. Not that we don't look at risk, but sometimes when we look at risk, we don't fully digest it in the way that we should. Okay, you don't go before you eat char kway teow, right? Yesterday I was thinking, wow, but 1,100 people die of food poisoning in Malaysia. Should I eat this plate of char kway teow? We inherently know that there's a risk there. Got siham there, got cockles, not properly cooked. I might get food poisoning. People die from food poisoning, by the way. But we don't necessarily process risk that way. So I want to basically urge everybody, when you think about risk of vaccine, don't think of risk of vaccine, right, as something that is super different from the other risks that we normally take anyway. So you have to weigh the risk, right? And this weighing the risk is something that we don't do very well. So part of the talk today is I'm trying to help you weigh the risk appropriately so that you put the risk in context, so that you're not frightened or fearful of the risk that is actually very small.
Thanks, Fong. There are a lot of questions regarding blood thinners and also the specific types of blood thinners. Now, if you're on this medication and asking whether you should be vaccinated, can I just encourage you to reach out to your treating physician to clarify with them? Right? Because if everybody has a specific medication, then yeah, we will take a lot of time for that.
Okay, basically there are very few medication that you are taking that basically stop you from taking the vaccine, including blood thinners. Okay, now there are some people who are on active chemotherapy, for example. They are not to be vaccinated, not because there is a danger to vaccinate them, but because they may not have the immune response, appropriate immune response to the vaccine, because you are immunosuppressed, right? So your body then cannot learn how to have the immune response to while you're on active chemotherapy. It doesn't mean that all chemotherapies are the same. Some chemotherapy are not immunosuppressive. Some chemotherapy, like immunotherapy, for example, certain immunotherapy are not immune suppressive. Therefore, you can take the vaccine. So it's very, very complex. So the best thing to do is to ask your treating physician, because he knows what you're taking. Now, generic blood thinners like aspirin, like Plavix, and all the rest of it are not, doesn't stop you from taking the vaccine. You just need to tell the people who are going to jab you that you're on it, okay, and what you're on it, what vaccine, the list of vaccine that you're on it, and they're all briefed, they're all trained, they all know if you're on certain vaccine, they say, okay, certain treatment, they say, okay, this one you have to wait, this one you can't. They will decide for you. You don't decide. You want vaccine, you register. When they ask you the question what you're on, you all answer honestly, that's it. And they will make the decision for you to vaccinate you safely. Okay?
Fong, there are two questions regarding mRNA vaccines.
mRNA vaccine.
Yeah, mRNA vaccines, but
Okay.
are linked to the same point, is that does it open a backdoor to the human immune system to allow other viruses to come in?
It doesn't. Okay, maybe I know this is a Pfizer vaccine and a Moderna vaccine, but of course we're not getting Moderna, we're getting Pfizer. Okay, this is an important question. Why? Because 50% of our vaccines in Malaysia is going to be Pfizer. Okay, remember statistically, 1 in 2 people who are vaccinated will get the Pfizer vaccine. Now, Pfizer is an mRNA vaccine. Now, what is mRNA? mRNA just means messenger RNA. Okay. Now, what is messenger RNA? So you imagine our cell, right? We got a cell, okay, a human cell. mRNA is in our body all the time. Everybody has mRNA floating in our body. It's actually absolutely essential for our body. What is mRNA? Now, mRNA essentially is a copy of the DNA, and it's a copy to instruct the protein synthesis machine in our body to make protein. Okay, DNA is a genetic code. Genetic code is like the recipe for making protein, because protein is the end product. It's like DNA is a recipe book for cooking nasi lemak. Okay. Now, how do we translate what is in the recipe to cooking it, making it, right? So the DNA is in the library. So this is in the cell nucleus. Okay, this cell nucleus is very protected one. It's got all sort of things to protect it, okay? Because we do not want mutation to happen to DNA, because we don't change the DNA. So basically, the mRNA is a little messenger, little copies of the DNA that is copied inside the cell nucleus, that comes out from the cell nucleus into the main cell body to give instruction to the protein synthesis thing to make the protein. That's how it works. Now, after about 72 hours, the mRNA is then destroyed by the body. All mRNA just disappear. And this happens to our body all the time. It continuously happens. Now, the virus, COVID virus, is an RNA virus. So it injects RNA into the cell. And this RNA code, our body don't recognize it as any different. It still looks the same as our normal mRNA. Therefore, we just then produce, using the recipe from the virus, and make viral protein now. And that's the problem. Okay? So the viral protein then becomes more virus, and then infect more cells, and therefore we end up in trouble in COVID. In fact, not just COVID, but a lot of viral infections happen. Now, the mRNA vaccine works by mimicking that COVID RNA that COVID is going to inject into your body anyway. But instead of having the whole long strand of the COVID RNA, which have all the nasty bits in it, let's say this bit is not nasty, this one just allow you to enter, but this bit is the one that caused the disease. We take away the one that caused the disease. We only allow this little key to be replicated, which is the spike protein. So now our body produces spike protein only, not the whole virus. Therefore, the spike protein cannot do anything because it's just a little key. It has no harmful bits to it. Then our body recognizes the spike protein and then attack any future COVID with the spike protein. That's how vaccine works. Now, why doesn't mRNA vaccine cause problem to DNA? Because mRNA on its own cannot re-enter the cell nucleus. There's no reversal. It's a one-way traffic. Okay, therefore, there's no prospect of the RNA, the mRNA that's injected in our cell, being able to change the DNA. It's just not possible. Okay, so we must get rid of this fake news. I can say it's a fake news that is floating outside because RNA sounds like DNA. They're both genetic material. It can cause mutation and cause cancer. It doesn't. It's not possible. All right.
Okay, thank you for that, Elder Yifeng. Sorry, I'm just checking out the chat group. So thank you, Geching, also for answering for the flu jab questions. I will move on to a Sinovac question. Gary has actually said he feels that there's not much data provided for the Sinovac vaccine, and he'd like to know how safe it is.
Okay. Now, Sinovac vaccine is by China. So most of the data, of course, is in China, right? Because they vaccinate a lot of people. It's also used in various countries like in Brazil, in Turkey, in Indonesia, particularly our neighbor Indonesia. Now, the Sinovac vaccine, because they are, China, right? They are not so open to getting the data out, just as a country. In scientific literature, it's like that. Yeah. But having said that, there are a lot of data already. Okay, so if you look at Sinovac vaccine, right, the effectiveness of Sinovac vaccine varies between 60 to 90%, which is quite a wide variation, 50 to 90%. But the effectiveness against severe disease, there's a medical journal, I think in Lancet or New England Journal of Medicine, that it protects 100% in that particular study from severe disease. So I would say that Sinovac vaccine maybe not as effective as Pfizer in terms of preventing infection, but it's equally effective in preventing severe disease, which is almost 100% or 100%. That means if you have Sinovac vaccine, 0% in that particular study, which involved tens of thousands of people, actually have severe disease. That means you have Sinovac vaccine, it makes COVID like a common cold, okay, which is good, right? Now, how can you compare with Pfizer? Because of course, we've got Pfizer as Sinovac, right? It's very hard to compare. But the thing is that at this moment, you can't choose anyway. So if I am you, let's say I'm not vaccinated, right? I will take Sinovac if that is offered to me. Because in the end of the day, right, let's say in the future where vaccine is more available, you can choose again. You can vaccinate again now if you want to. I mean, no big deal. So let's say you have Sinovac now, 4 months later, a lot of vaccine available, people are vaccinated because after all, Malaysia order more vaccines than required by the population. There's a lot of vaccine around, and you can just go and get your Pfizer jab again. You pay money, this time maybe the government won't pay for you anymore. But big deal, you just go and have it jab again if you're not sure about Sinovac itself. But if it offered to you now, today, I would take it because your risk of getting COVID and having problems with it is far, far higher than and whatever protection you get, even if it's 50%, 70%, 80%, it's still better. Okay, just look at it this way. Let's say you meet a guy who is positive. Okay, you have a meal with him, he coughed directly in your face. You got high viral load. Without the vaccine, you're almost certainly going to get COVID. Okay, if the vaccine is 50% protective, you half your chance. If it's 90% effective, it's 10% with COVID positive cough in your face only. You may kena one time. Even then, you won't die from it because you won't get severe disease. That is great. That's wonderful. Take it.
Yifeng, there's a very good question from Kenneth, actually. He asked if, since there are many things going on internet, the positives and negatives, pros and cons of vaccines and things like that. Yeah. So in a way, I think his question is, how do we
tell the difference?
Yeah.
Yeah. Okay, how do we tell the difference? We tell the difference by looking at the source. Okay, number one, if your social media come with an article or with a thing now, okay, that's forwarded many times, there's no source in it. That means there's no, where does this material come from? No source one. Somebody just typing a long opinion piece and then get sent to you. You read it, you say, oh yeah, it makes sense. Do you forward it? Don't forward it, because if there's no source, it's unreliable. Full stop. Okay? No source, unreliable. So I would say even the message may be good one, maybe pro-vaccine even, but no source, don't forward it. Don't forward it. Okay. Now let's say you have a lot of it. I also see, a message come out with a video or something, and there's some website where it comes from. Do a bit of investigation. Look at the website, but don't necessarily just go to the website itself. Let's say it comes from website abc.com. And don't just look at the website, what they say, because the website, the whole thing may be just fake, because there are so many websites now that's created, and there are a lot of naughty people out there who create websites, okay, as a propaganda kind of thing. Yeah. It creates a lot of problems. I would get all my information from trusted website. And what are the trusted websites? For me, it would be your WHO website, your CDC website, your Malaysia MOH website, mainstream media that are trusted, like BBC. Of course, some of you don't trust BBC. Things like that. Okay, or speak to someone who knows about vaccine. Okay, like a doctor, right? A proper doctor. Okay, there are a lot of people with the title doctor in front of them are not doctors, by the way. You have to be very careful. They call themselves doctors, but they are not real doctors. And even there, okay, having said that, there are also some doctors, real doctors, who are also anti-vax, but they are in the super small minority. Okay, so it's hard. I know it's navigating through this is really difficult. Okay, but I've come across all sorts. I mean, just like you, I also have WhatsApp. I also have Facebook. So I can see all these things. I click on all of them. I'll have a look at them. I can tell you 99% of the time, I can tell you by just one click, I know whether the information is fake news or not fake news. And if I'm not sure, I can just spend about 2 minutes Googling on it, and I can figure it out. It can be done. Okay, but I know it's difficult. For the average person, it's very difficult. But I want to let you know that information that you receive must have a source. Okay, not chili sauce, yeah. Must have source. Okay? It must have where the information comes from is very important. But I also understand there's a trust deficit in the population. That means we don't trust authorities anymore. We don't trust people who say, like, we don't trust the government, therefore we don't trust the website. We don't trust WHO because therefore we don't trust the website. I understand that. I understand that there is a big trust deficit with authority. I totally understand. Okay. I have looked at it very carefully myself. Okay, I'm using my trust credit here because majority of people here knows me. Okay, I'm using my trust credit here to bridge the trust deficit.
That's
as
true.
a doctor, yeah, as someone who loves you. Okay, I know most of you here. I'm telling you, vaccine is not 100% safe, but it's very safe, and it's far better to take it than the chance of having COVID.
Yes, on that note, actually, if you have signed up for the Seniors Tech course, you will also be briefed on how to vet through which websites are worth looking at. It's very easy, especially if you see something that says www.ihatetheworld. You probably don't want to read things from there, huh? Just a tip on how to vet through your sources. Going to Matthew's question, it says the recommended duration between first and second dose of the AstraZeneca is 4 to 12 weeks. Do we choose when to take the second dose, or is it decided by the government? It's
decided by the government. There is a schedule. So it's based on availability and the internal scheduling. The current Malaysia government is following the recommendation of the vaccine manufacturers strictly, okay, at the moment. Now, you know that the vaccination in UK didn't follow the recommendation of the vaccine makers because they come to the conclusion that they want to vaccinate more people rather than vaccinate 2 doses of less people. Okay, that strategy seems to have worked really well in the UK. So that may change the way that the rest of the world may vaccinate people. I don't know, it's an evolving thing. So you don't get to choose, it will be just allocated to you. Now, if you're offered a date, right, for a vaccine, right? Treat it as the most important thing in your life. You drop everything else and you go. Okay? Yeah, you drop everything and go because that is a priority. It's a major priority. Don't say that, yeah, I got date with Pastor Melissa, or I have to meet Pastor Alexa. I will wait. She will get angry. Yeah, no, she won't get angry. In fact, she will drop you if she get a date for vaccination.
Okay, answering two people here. Is vaccination safe for someone with autism? And is there any data? And should a 95-year-old person, is it safe for a 95-year-old person to be vaccinated?
Yes, Mahathir is vaccinated, so he's 95 or thereabout. So it's safe. Of course, the 95-year-old may have other health conditions. So you may want to, again, consult the doctor that normally take care of the 95-year-old. Okay, so I think you have to take that into consideration. For autism, there's no contraindication. Autistic children or people with autism can be vaccinated. This vaccine does not cause autism or make autism worse. In fact, no vaccine causes autism or make autism worse.
Okay, thank you for that. With that, actually, we finished I think we finished all our questions.
Really?
But there was a person who raised their hand. It was Alex Hang, which I'm not sure if he still has a question to ask. I'm only addressing him because he's the only person who raised up his hand. Yeah.
Okay.
Is Alex still here? And if you would like to ask your question, you can unmute yourself. 5, 4, 3, 2, 1. Okay, Alex, if you do still want to ask your question, just raise your hand again. You did it well just now. Okay, we have one more question from Asia. Just came in. Is it possible to develop a resistance to this vaccine treatment soon, since there seems to be new variants emerging in different parts of the world?
Certainly, yeah. There is this risk. So one of the risks is that because the vaccine is designed for the virus that we already know currently, so therefore new variants, new changes in the virus may mean that the current vaccine may not recognize the immunity that we develop from vaccination, may not recognize this new variant of the COVID virus. I already showed you a slide earlier. Maybe I just screen share again. I'll just show you again. Okay, let's look at my slides again. Yeah, it's possible. So for example, this slide, you can see that the current vaccine is effective against the coronavirus, most of it, but the variant from UK, for example, is effective, okay? But you can see that the South African one, this is what we are slightly worried about, is the South African variant, whereby there's a reduced antibody levels for the same vaccine that has been used there, okay? So it can change. And hence the importance of doing vaccine quickly, actually. Because if you don't do vaccine quick enough, that is the problem. Okay, that is where the ability for the virus, you give more time for the virus and more virus, because there are more people infected, to have a chance for mutation. So this wait and see attitude is actually not a safe attitude. It's actually detrimental for the vaccine program, because you allow the vaccine to lose its effectiveness, because virus, especially RNA virus, by the way, is highly mutagenic. Mutagenic means that they are able to mutate very, very quickly. So that is one thing. So we shouldn't draw out vaccination too long. Okay, we shouldn't resist. Wait. Okay, I have a target. Only if 80% of the population vaccinated, then I will go. Right? Don't have that attitude, because you may be contributing to the problem of making the vaccination program prolonged and delayed, and therefore giving more chance for the COVID virus to mutate.
Okay. Okay, I see Lily and I see Chris Lim's questions, but before I get to that, I just want to repeat to those of you who are asking regarding blood thinners, allergies, autoimmune diseases. if you are currently in touch with your treating physician, please talk to them about the suitability of being vaccinated. Secondly, the idea is that if you want to be vaccinated, apply, register. And when you're called upon, they will give you a form to fill out. Disclose your concerns. So Kaiken, like you said, you're allergic to a certain painkiller, disclose that so that when you reach that station, they will tell you whether you should go in or not to be vaccinated, right? So disclose what you're allergic to.
Yeah, the disclosure, I know in the form in MySejahtera, you cannot disclose specifically information. I know that, okay? It doesn't matter. You can't disclose it because the thing is that because this one go into a database, right? And the database is automated, right? They can't, it's very hard to sort it out. And you've got spelling mistake, typos, and so on, which is just impossible. So just disclose whatever you can based on the MySejahtera app. You'll get appointed, an appointment. Whatever you put in, you will still get an appointment. And when you go to that the station whereby they do what we call triage. Triage means that they want to find out, okay, are you suitable candidate? Most people will just sail through that part because they say, oh, I have no problem, then they just sail through. But for people with a bit more complex history, a doctor will attend to you and they are properly briefed as to how to handle the situation, okay? You understand? So don't take it upon yourself to decide on this, yeah? Because it's hard for you to decide on this, I know. So let the professionals take care of you, okay? Your decision is to decide, do I want protection from vaccine or not? That's it. If you want, get yourself registered.
Elder Fong, easy question, since you have done it. What languages are the form in?
Unfortunately, it's in Malay. The one I've done are all in Malay. Now, if you are not good in Malay, you go with someone, it's okay. Yeah, go with someone who can help you. The consent form is also in Malay. They may change that in the future, I don't know. But the frontliners are all vaccinated and are consent form on Malays. Having said that, they are all professionals. You speak to them in English or you speak to them in Chinese, they will find someone to help you. It's okay. Yeah, they have briefing. They're all very nice one because we all want to get people vaccinated. Hera doesn't know Malay very much. She also went through the vaccination. See? Show your face, please.
It's okay. Don't worry. You can ask them.
Yeah, this is a foreigner. Yeah.
Very interestingly, I just got information that the AZ slots have run out already. So 7 minutes into opening of registration, and there are no more slots. So people really do want to get vaccinated.
Yeah. Which is good. Okay, you know why? Because we have 12 million doses of AstraZeneca. So now that the government knows, okay, the demand is really there. Yeah, there's no hesitation in that side. There are enough people. Then what will happen is that they will just get the import in. Okay. Now I know at the moment everything is very slow. You registered, nobody informed me, nothing seemed to happen. I'm also because my parents also not vaccinated, right? And so on, right? I understand it's waiting. The limiting time is not manpower at the moment. It's not because the doctors are lazy, they're not vaccinating. It's not the government don't have enough allocation for people to vaccinate. No, it's due to not enough vaccine. It's just insufficient vaccine. We just went to, I just had my second jab in a vaccine center. Empty, nobody, hardly anybody. The people working there a lot. I asked, how come so few people? The answer is, there's not enough vaccine, that's it. Okay, but the situation will change, okay? Because by June and July, based on our vaccine schedule, there are millions and millions and millions of doses coming in, okay? So at the time, there will be a rush. And then at the time, maybe the logistical challenge of vaccinating people becomes the challenge, all right? So if you want to be in part of the queue, then you just have to register and join. Okay.
Dr. Fong, just a quick question on blood pressure. Do they take your blood pressure at the triage? And if a person, they don't.
Yeah. My experience, they don't. But I think because the frontliners are all generally healthy people and so on, so they didn't. They may do, for some cases, if you are at high risk, for example, let's say you disclose that you have hypertension, they may do it. I don't know. I mean, I don't have. So I didn't see any of my colleagues or people who vaccinated with me have their blood pressure taken. But obviously they can do it if they need to. Again, blood pressure, high blood pressure, you're on treatment doesn't stop you from getting vaccination.
Okay. Because the question from Chris is it advisable for a person who is not sure if she has high blood pressure to go for vaccination if she has gotten her?
Go for it, get registered. And if need be, they say, I have very, very high blood pressure, I'm not sure. They will have a device that can measure your blood pressure. No problem. I mean, that's a simple thing. All right. And we can figure out.
Okay, Renee's question is very cute. She says, I have registered in My Suggestion on 20th March and still waiting for a response for appointment. How long more to wait for appointment? I also
Okay, it depends on how old you are, Renee. If you are a young person, you will have to wait a lot longer, okay? If you're not in phase 2, you'll still have to wait a lot longer. If you're in phase 2, your appointment will come. Okay, bear in mind, your phase 2 extends from May to August. May to August, okay? No, sorry, April to August, okay? April to August, which is a long duration because there are a lot of people. So therefore, you have to wait, okay? Phase 3 will start in May. They didn't say early May or late May, we don't know, okay? It will start. So again, we have to wait. The important thing is just to get registered. I know there's this anxiety about when you're going to get your vaccine date. I understand that. I totally understand that. But at the moment, we don't have enough vaccines, so we have no choice but to wait.
Okay. If you have any last questions to ask, we're going to wrap this session up by 12:15. So I would request that you just type them quickly as I just bring out one question for the Fong. Do you think it's worthwhile to just show up at a hospital and even if you have not received an appointment?
Okay, there's some theories not in Malaysia so far, but or at least I do know of. But certainly in a lot of vaccine centers in the world, they allow you to do that. Partly it's because the Pfizer vaccine, for example, one vial of Pfizer vaccine has got 5 to 6 doses in it. Okay, so they draw out and they inject. Let's say at the end of the day, the last appointment guy, you have to open a new vial for him. So you use up one dose of the 5 or 6 in one vial, right? So you don't want to throw that away, ma. So then they will offer it out to whoever is available on the spot, wants to have it now. So some people in some other countries, I'm not sure if it happened in Malaysia, they will wait towards the end of the day. Okay, they will wait. Hopefully, there's availability. I mean, you can try that if you want. I don't know whether that will work out.
Okay. Thank you, Dr. Fong. Gung ho, yes. Gary has one more question, and it's there is some news about Pfizer vaccine causing deaths in 20 to 30-year-olds because of elevated heart rate. Is this true?
Okay, most of these have not been shown to be conclusively related to the vaccine. Okay, now maybe I want to share something. Okay, this is also a very important thing here. Okay, I want to share something. Maybe as one of the last thing I want to share. Okay, just screen share. Give me a second. Okay, now I want to introduce to you this concept. Just because someone died 1 week, 2 weeks, 3 weeks, 4 weeks, 5 weeks, 6 weeks after vaccine, or have a harmful effect, diarrhea or loss of hearing or blindness or whatever it is, 1, 2, 3, 4, 5, 6, 7, 8 days after vaccine, does not naturally mean that the vaccine is the cause. Okay, therefore you can see this happening. Okay, for example, when the Pfizer vaccine was used in Denmark, right at the beginning, right, there's a report like 40 people died following vaccination. Within a month of vaccination. So then what the doctors do is that we will investigate, is these 40 people actually died due to the vaccine or not? Okay. Now, if it's not, then we continue the program. But we report it, people report it. Therefore, the news also report it. But this doesn't mean that these 40 cases die of the vaccine. Okay, I'll show you why, okay? Now, this is a slide, right, that shows that every time when the sale of ice cream increase, there's more shark attacks in Australia. This is Australian data. Every single year is the same. January, very few ice cream sales, very few shark attacks. When you come to July, so August, ice cream sales increases, there's more shark attacks, more people die of shark attacks. Every year they look at this data, it's the same, okay? So we can conclude that eating ice cream causes shark attack. Does it make sense? Does it make sense? Does it quite make sense? How does eating? But it's true, every time ice cream sales increase, shark attacks is more common. Of course, eating ice cream doesn't cause shark attack. So the correlation, the fact that ice cream sales increase and there's more shark attack does not mean that ice cream sale is the cause of shark attack. So this concept of correlation means that this association, this link, the newspaper use the word link, is not causation. Causation means that something causes another. Now, both ice cream sales and shark attack increases when the weather is hot. Okay. By the way, this is not Australian data, can't be Australian data because this is a northern hemisphere. Summer is warm, right? So because it's hot and sunny, therefore you eat ice cream sale increases, and it's hot and sunny because then only you go to the sea. So the common factor is summer. Okay, now why do I use this example? The same thing with the Denmark situation. Why did 40 people die after vaccination? Because they are old people, they're 85 and above, in that particular situation. 85 and above in 1 month period in Denmark of a population of several million. When you vaccinate old people in the 1 month period, 40 and 50 old people will die of whatever cause, heart attack, old age, whatever. And just because they got vaccinated a month prior to that does not mean that the vaccine caused it. It's because they are old. Okay. So that's why it's very important that when we read all this report, all these WhatsApp messages, someone died of vaccine, a teacher died of vaccine in Kedah, following vaccine. We cannot say that because she received vaccine one month ago, it's the vaccine that died. It's a bit like me now, I got diarrhea today. Okay? I was thinking, what caused it? Oh, must be because of the phone call conversation I have with Hera. That caused the diarrhea. It doesn't make sense. But it is correct that every time I call her, and then later I need to go to the toilet or something. But it's not. But because at the same time, I add siham. Okay, the siham is the cause. Anyway, sorry. Okay, I don't want to label the point anymore. So I think we need to be careful when we read all these things, so that we are fully informed.
Thank you.
Thank you.
Okay, I'm going to just ask you one more question before I pass the time to Pastor Yu Yong.
Okay.
This is from Dr. Richard. Do you know if the vaccine has any effects on fertility?
Oh, vaccines on fertility, no effect. I don't see any reason why it should, from the science point of view. By the way, most of the vaccines, like the conventional vaccine, right, they use viral vectors, are not new. Okay, we vaccinate our children. We have vaccination program, active vaccination program in Malaysia for the longest time. MMR vaccine, the polio, and so on and so forth. There's no problem with infertility, and vaccination is not new. To us, it sounds very new, but it's not new. Vaccine has been around with us for the longest time. All children, all of us have vaccine before. If you look at your arm, you know, right? You all have been vaccinated. So vaccine is not new. What is relatively new is the mRNA vaccine, which is new. Okay, and the way that it works scientifically, right, have no mechanism whereby it can cause infertility. There's no mechanism. It's just like eating ice cream does not transport you to London, because there's no mechanism this ice cream can suddenly magically make you fly to London. There's no mechanism. So that's all I can say.
Thank you for that, Elder Yifeng. Also for your patience in answering all our questions.
No problem. Thank you. Yeah. I'm delighted to do this because I really want everybody to be safe. Right? And I know as a medical doctor and from the scientific data that vaccination is the best weapon they've got against coronavirus, not only in terms of disease preventing the disease and preventing death, but also in opening the economy, helping us go back to normal again. And it's already happening in Israel. Israel is going back to normal. And UK is going back to normal. I think in about 2 to 3 months' time, UK will begin to allow people to fly into UK because they are confident enough that their population have herd immunity. And we want to get that, okay? And it doesn't make sense that now that we have the ability to get there, we don't want to get there because of this irrational fear, this fear that is not based on facts.
Thank you. Pastor Yeo, I'll pass the time back to you.
All right, thank you very much, Pastor Melissa, Elder Fong. I just want to confirm that is this video will it be available on YouTube?
I haven't said anything controversial, so I suppose it can be on YouTube. Yeah.
All right, yeah. So this session is recorded. We will be releasing this video in a day or two. It will be available on our PGFC YouTube page. All right, so thank you very much. If any questions, you feel free to reach out to us, your pastors. We will communicate your questions to the COVID experts in our church. Yeah, so yeah, don't worry if your question is not answered yet. Yes, we can still ask for you. All right, so let's close in prayer. Father, we give you thanks for today's session. We want to pray, Lord, with the information that we have learned from today, that we make good decisions to love others, to love our community around us. So, Father, we want to pray, Lord, that as that some of us might have fears, we want to pray, Lord, that you dispel all fears, that you allow us to do the right thing. So, Father, we want to pray that you be with us, give us a good week ahead, and bless our lunch. In Jesus' name, amen. All right. Thank you, everyone, for your time.
Thank you, Fong. Thank you, everyone.
Right. Thank you, Fong. See you all. Take care. The meeting's over.
Thank you. Thank you.
The vaccine, Astral vaccine website is back on. Continue to try until you are able to get it. Persistent pays off, guys.
I'm spamming it now.
So have you registered or not? Who else have registered?